Hello everyone, my name is Anthony. Today I'll be presenting our research paper titled Unified Auto Clinical Scoring with Interpretable ML Models. I'll attempt to answer three questions: why, what, and how. Despite the advent of explainable clinical ML models with SHAP and LINE, clinical scores remain to be the most popular form of clinical risk assessment. In fact, over 65% of US clinicians use clinical scores on mdcalc.com every month. It is popular because it's easy to remember, easy to understand, correlate clinically, and easy to apply without a machine. Current state-of-the-art clinical score development include the classical and the risk-themed clinical score development methods. However, these methods present the practical problem of forcing black box ML models and clinical scores to be constructed in separate silos. By doing so, there's no consistency between ML models and clinical scores for both model interpretations and risk assessments. Therefore, we present our solution, Unified Auto Clinical Scoring, Uni-ACS, which is a post-hoc, automatic, and model-agnostic method that translates SHAP-compatible black box ML models into clinical scores. Additionally, it is consistent as it forces the clinical scores interpretations to agree with the underlying black box ML models interpretations. Lastly, it has reasonable predictive performance retention of underlying black box ML models. Uni-ACS works by taking inspiration from the classical clinical score development framework. There are 5 steps as part of this classical framework. 1. Feature selection. 2. Feature value categorization. 3. Logistic regression modeling. 4. Scaling and rounding of logistic regression model coefficients to create clinical scores. And 5. Calculation of risk score mapping. We make specific changes to the heuristics and algorithm of the classical method to develop Uni-ACS. It consists of 5 steps. 1. ML modeling and SHAP application. 2. Feature selection. 3. Feature value categorization. 4. Scaling rounding of feature aggregate SHAP values to create clinical scores. And 5. Calculation of risk score mapping. In our paper, we have 3 main findings. Firstly, clinical scores produced by translating black box ML models with Uni-ACS are comparable to baseline classical and risk-themed clinical scoring development methods. Secondly, these scores have competitive drops in predictive performance compared to the original underlying black box ML model's predictive performance. Thirdly, as shown in the figure, Uni-ACS clinical scores aggregate SHAP interpretations, represented by the yellow line, were shown to consistently follow underlying ML model's SHAP interpretations, represented by the blue line. You can visit our poster at the conference, read our published paper in the proceedings, and access our code on GitHub. Thank you and see you soon at MIHC 2022.